trying to get something else going, and that's with the Overdose project and getting naloxone on the street, and because there's a big push for overdose. I mean, there's more people dying of overdose than there are car crashes in the United States. And so when people are dying and nobody's paying attention, it's time for people like myself, Mark, and others to stand up and start hollering from the rooftops. Big push on a national level to get what is basically a drug that does absolutely nothing but reverse overdose.
Family members and friends have to know and be trained and comfortable with rescue breathing, how to call 911, and what to do as far as administering naloxone. It's a simple 10-minute training to save a life. So Narcan is what they call an opiate antagonist, okay? It basically, what it does is that when you take an opiate, you have opiate receptors. When you take an opiate, the opiates actually sit and bind to the opiate receptor, okay? So Narcan is a little bit simpler compound, and what it does is actually goes in between the opiate receptor and the opiate, kicks the opiate off the opiate receptor. What opiates do is slow your breathing to the point where you stop breathing. What Narcan does, kicks the opiate off, okay, allows you to start breathing. Oftentimes you have to have help with rescue breathing. Here's the thing, you have to talk to people and educate people about the combination of drugs, okay, because benzos, alcohol, and heroin or other opiates are a fatal combination. They all work on the same part of the system. They slow and do the same thing. One of the things that happens is that 30 to 90 minutes wears off, the opiate's set back on the opiate receptor, you're not dope sick anymore. We have to talk to people about not using while they're in that process, because it'll just compound the issue. So, 2 ways at this point to administer Narcan in this country. One of them, in many states that are doing it, Massachusetts is doing it, the Boston Police Department, Quincy Police Department has been doing Narcan administration when they respond to a overdose scene for about 18 months. They have reversed over 225 overdoses. So this is basically a nasal spray applicator. It's already a measured pre-dose. It's a higher concentration of Narcan, excuse me, and it goes into the nasal. The applicator itself is really relatively cheap. It's actually about $50 for the nasal applicator, the Narcan, and the administrator here. The nasal applicator just screws on really simply. You just tighten it. The Narcan, already pre-dosed, goes into the barrel. You turn it until it locks, okay? Basically what you would do is you would administer half of that dose into one nostril and half of that dose into another nostril, okay? 3 to 5 minutes, that individual will come out of that overdose more than likely. If not, you need to maybe administer another dose. Most times, people will come out of it. Let's just be honest, there's Narcan on the streets of Austin right now. People are using it. We are getting reports of reversals. This is an intramuscular syringe. It's usually around the 22 or 23 gauge syringe. Similar to what you would use to administer the flu shot, okay? It's a 3 cc. So basically what you do is you take the intramuscular syringe, you put it through the skin of the vial, okay, and turn this upside down. And what you want to draw up is 1 cc of the Narcan. Once you have it in there, you pull it out, and you hit somebody with either in the arm, the thigh, or the booty. A meaty place. 3 to 5 minutes. If they don't come out of it, you can administer another one. We need to also encourage people to call 911, get help here. The reality of it is even if people don't have Narcan, we can save their lives by teaching them how to do rescue breathing. The cure for an opiate overdose can be
Breathing.
oxygen.
Yeah.
Okay. And by the way, only about 10% of all overdoses are from street heroin. And the rest are from prescription medications.
Talking about that, getting people aware of this, even going, talking to doctors when they prescribe an opiate. Why aren't they at least giving a flyer?
There is going to be a overdose awareness vigil August 31st. It's part of the International Overdose Awareness Day. We will probably hold a vigil prior to that for people in this area that have lost people, to express and to grieve and to do things. And there's a parents group or family members that's also going to be starting. It's going to be run by a licensed clinical social worker who worked in the midst of the AIDS epidemic in San Francisco. More than anything else, understand that you are not the expert in that person's life. That the individual that sits in front of you is the expert in their life. There is something that has gone askew, that your training as a counselor can help bring them back to the center. There is a spiritual void in a lot of these people. These are not bad people. These are people that are, as we use oftentimes, there's an emptiness, there's a hole, there is a lack of hope. And part of, I believe, what a counselor's job is to do is to unblock some of that stuff so that that hole can be filled, and teach individuals where they can access some of that help. Because one of the things, especially with this population, one of the things that I know really powerfully is that we are probably the most resourceful people on the planet. And that when given some really good direction that's helpful, non-judgmental, and assertive, don't pussyfoot with us. That we will come out of this thing if we choose to. But the other thing around counseling that I think is really powerful for drug users in particular is that understand that oftentimes the drug is the solution. It's not the problem. The problem is what's not being coped with appropriately. And so I think really digging in and finding somebody's core issues around why they're using narcotics, because 95% of the time it's not just to get high.
You take the emphasis off of the drug and put it back onto the person, because it's like you said. And yeah, sometimes you have to get rid of the drug in order to get at these core components, but sometimes those core components are so deep that you're not, by the harm reduction model and allowing these people, it's like Pat Denning's harm reduction treatment center out in San Francisco. Come as you are, and you don't really have to be in any place other than willing to walk through that door. Thanks.
I think it's really important, what Brad just said. I think that when I was talking about actually, even so with the hole in removing that blockage, is that oftentimes the drugs are the blockage at some point. What was the solution has become the block. And so at some point we do have to remove that. The other thing is that people have a misconception of what harm reduction is. Like, harm reduction is not just thinking that people, can use, and that we're not, that, listen, the greatest form of harm reduction I've ever seen in a lot of people's lives, not in everybody's, but in a lot of people's lives, is not using. It's a great form of harm reduction. Is to get people in a place where they can see clearly enough that they can find alternative ways to cope with certain things. We talk about, people talk about those individuals are insane. Well, the definition of insanity is not what we think it is. It's not doing things over and over and over again expecting different results. Although that is a definition of it. The definition of insanity is the inability to think clearly. Let's get people to a place where they can start to see a direction for their life. And stop. Listen, society has told us we're bad people. We get it. Don't just say, you need to just stop. Geez, why didn't we think of that? That's such an asinine statement to us.
Yeah.
We need help. That's, I think, why people get into counseling field.
I
Believe that
do.
we get into it because we want to help.
Yes.
There is a calling. That, that place where our inner joy and our inner terror meet. That's the calling. And so I think that if people can tap into that, it would be helpful.
Yeah.